The state first considered ground zero for coronavirus infections in the United States is now finalizing details for a vaccine rollout. Washington Governor Jay Inslee said he has no concerns about distribution after a call with federal authorities. The vaccine is on its way, but it will not be there or anywhere, frankly, soon enough. Washington State says another shutdown is on the table there after it broke its own records for new cases day after day in the month of November. Joining me now is Washington Governor Jay Inslee, who was just reelected for a third term. Governor, it is always great to have you. Let's talk first about distribution of a vaccine. I know you've been asked to put together a micro plan. I'm hoping you can walk me through the steps that Washington State is taking and how it's going to work.
Well, you bet. We think we're in good shape on that distribution plan. Just most recently, in the last hour or so, we're trying to get enrollees to be recipients of the vaccine. In a few of our counties, I'm confident we're going to be able to get that done. We feel good about our refrigeration capacity in general. We think we have the personnel, certainly, to be able to distribute the vaccine. So we feel relatively confident about the distribution system. I wouldn't say, if I said I had no concerns about that, that would not be accurate. All 50 governors are, staying up late at night to make sure this plan gets effectuated. But I do want to clear that the thing I do feel good about is the confidence in the regulatory system of making a decision. I'm very pleased that the FDA and the medical community has stood up against the assault from the president on the integrity of the system. And this is really important that they have succeeded in this to date so that we have confidence of people to actually get the vaccine. That was something that was at risk, and I think the system is succeeding against the assault by the president on this, and that's really important to make sure people will have confidence in the vaccine.
Are you going to be doing your own extra layer of vetting this vaccine before you distribute it?
Yes, we do. In combination of the Western states, we'll have what will be an appropriate but fast review, and we feel good about that because they've been able to follow the process to date. And the thing that I'm pleased about is that the transparency of the system. The manufacturers have already shared their protocols. For instance, they've never done that before, so that our reviewers can look at the protocols to make sure that every base was touched. And that'll be very, very hours or days to get that done. So things are on a safe track and a timely track, and I'm happy about that, to be able to report that I believe we're going to have high confidence in the decision, and so far the distribution plans are on track. But we got to understand the early days when we have distribution to the medical community and to the long-term care facilities, to some degree, are the easiest days because those will be the smaller numbers. There are distribution issues that we still will be concerned about as we get to the broader public. And it's going to take a lot of cooperation by the public, too, of accepting the prioritizations that we'll need to make while the manufacturing capacity comes up. So far, I want to thank people for being patient about that. Because we got to make some hard decisions here about the prioritization. So far, I think we've had a good dialogue and good public acceptance about those decisions.
I want to get a question on climate in, but first I've got one more on the pandemic. How many doses do you expect to get on the vaccine? And if I was a resident of your state, how would I know when it was my turn to get vaccinated?
So we plan on having 200,000 of the Pfizer drug in December, and we don't have the exact number of the Moderna drug, probably a little less than that, hopefully in December as well. We're waiting for clarity from the federal government in that regard. We will have a, probably daily outreach effort giving people advice about what categories of people will be eligible in the priority array as we work through that. And that will be intensive. It's one of the things, actually, I think, one of the reasons we have been relatively successful in our state, despite our losses, we're probably in the top 10 as far as keeping the numbers down, is because we've been really focused on communication with people. I was pleased that it was reported we had the highest number of people who were going to have a safe Thanksgiving, #1 state in the country. And that happened because we've really spent a lot of resources and time sharing straight information with the public, and the public has responded well to that. So this will be a critical part. It'll be broad-based. It'll be in multiple languages. We just started a new app where now when your phones become in proximity of someone who is positive, you'll get an alert. We have over 700,000 people who've already signed up for that, and that will give you an alert in 29 languages. So I think that gives you a flavor of how committed we are to make sure we share information with people.
Governor, I've run out of time for climate. I hate losing sight of that other crisis that we are currently facing, but I hope you'll indulge us and come back again soon to fully discuss that. Governor Jay Inslee, thank you so much.
We got a president committed to that, so I feel good about it. Thank you very much. Be safe, please.
Well, good. I do have questions, though, so I want you to come back. Governor Jay Inslee, thank you so much for joining us today. And former NASA astronaut Mark.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.